And so I kind of refined it, and it's you got to eat right, sleep right, move right, talk right, poop right, and you're going to feel right. So it's literally those five pillars. It's obviously the food definitely matters, which is highly personalized depending on your microbiome. I think they did studies with twins, and they found maybe up to a 40% connection in identical twins with similarities in the microbiome. I mean, that's very dissimilar. So that becomes your blueprint. Obviously, movement matters. If you don't use it, you lose it. The body is designed to move, to sweat, to release toxins from lymph into excretion portals, such as respiration or through the skin, elimination, such as urine or stool naturally. The stool also, poop right. That's kind of where my focus has been for the last 10 years, is focusing very deep in the microbiome and microbial medicine, as I call it, to make sure that we're excreting. So we're not what we eat, we are what we absorb, assimilate, and then eliminate. So that matters.
Welcome to The Functional Edge. I'm Dr. Julia Ward, and this is where science meets real-world strategies for living healthier, sharper, and stronger. From uncovering hidden environmental toxins to unlocking peak performance and mental clarity, we cover it all. Ready to take control of your health and thrive? Let's dive in. Okay, hello and welcome to The Functional Edge. I am delighted to introduce a colleague who shares my deep commitment to root cause medicine, Dr. Daniel Chille. He's a functional medicine practitioner who approaches health and advanced diagnostic insight and with deep compassion. His work centers around gut-brain connection, hormonal balance, cellular function, and inflammation, and he's helped countless patients find answers where others couldn't. So, Daniel, I'm so excited to learn about your clinical wisdom. Thank you for joining us.
Yes, thank you for having me. Where would you prefer I start?
Well, let's start with what core beliefs drive your work with patients today that didn't exist for you in traditional models?
Core belief. Well, immediately what comes to mind is my Foundation 5, as I call it. And this is something I learned early on with one of my mentors. Actually, it was practicing out of Houston, who we spoke about previous to this call. And so I kind of refined it, and it's you got to eat right, sleep right, move right, talk right, poop right, and you're going to feel right. So it's literally those five pillars. It's obviously the food definitely matters, which is highly personalized depending on your microbiome. I think they did studies with twins, and they found maybe up to a 40% connection in identical twins with similarities in the microbiome. I mean, that's very dissimilar. So that becomes your blueprint. Obviously, movement matters. If you don't use it, you lose it. The body is designed to move, to sweat, to release toxins from lymph into excretion portals, such as respiration or through the skin, elimination, such as urine or stool naturally. The stool also, poop right. That's kind of where my focus has been for the last 10 years, is focusing very deep in the microbiome and microbial medicine, as I call it, to make sure that we're excreting. So we're not what we eat, we are what we absorb, assimilate, and then eliminate. So that matters. The talk is often overlooked in medicine. I think that the talk right component, so whether you have a spiritual belief or even the term of hope, physiology follows psychology. So until we tell ourselves, words of affirmation or positivity, we get stuck in this kind of like negative self-sabotage that I find most of my patients in, which just really heightens the burden of disease. So eat right, sleep right, move right, talk right, poop right. Again, that's my Foundation 5. So that's really my core that I start with.
That's awesome. That's great. I love how that you put that. It's easy to understand. It's stepwise. That's great. So you see a lot of patients with GI issues. What are the underlying triggers that are often overlooked?
So now we spoke this kind of at length when I had you on our podcast, which let me go backwards. So I'll typically see a lot of patients for GI issues, and unbeknownst to them, it's often GI issues. But what happens is we'll get patients about 75, 85% better, which they're very grateful for because they've been stuck for years, if not decades, seeing multitude of different practitioners from many different realms of medicine. But for me, that's enough. And then often I will do a mold or total toxin test, and I find very, very quickly that their toxic burden is extremely high. And then if you couple that with a genetic test to ascertain kind of phase 2, phase 3 detoxification pathways, whether they have impairment within methylation, glucuronidation, sulfation, etc. We get them on a very specific treatment plan to optimize the results to get to 100%. But looking at it from the root, the GI is typically where we start, because as I spoke earlier with you, we're getting a lot more mental health patients with intrusive thoughts, depression, anxiety, mood instability. That's starting in the gut. Most of our serotonin, dopamine, that begins in the gut. And we now recognize that the hormones or neurotransmitters of the brain, the hormones of the brain, start with our healthy microbes. So specific ratios within Firmicutes to Bacteroides, Proteobacteria, Actinobacteria. We go very deep on analyzing stool to optimize overall health and human performance. But many of our patients that come in with GI issues, they often don't recognize that it's GI, because I think it's estimated 60% of people that have SIBO are asymptomatic. How interesting. So people are walking around with this, what is now known as leaky gut, or colloquially known as intestinal permeability, and how that begins to affect every other organ system in the body. Autoimmune is a diagnosis of 7 years, meaning you've been deteriorating for that long that the body begins to attack organ tissue. Certainly now we see with the prevalence and having corruption in our food and our soil and our water, we are exposed daily. So the burden of elimination becomes much higher. And so with this representation of intestinal permeability, we have undigested food gets into the bloodstream, the immune system, the alarms go off, inflammation is upregulated, and now we have systemic inflammation unchecked. That's when you have chronic disease. So a lot of people, we don't feel sick until it's often too late.
Yeah, absolutely. Absolutely. So what tests do you rely on for assessing gut health, and what markers do you find to be the most predictive of patient outcomes?
You know, the best test is the individual. You often don't hear that, right? So we complicate medicine in some regards. We've lost this intuition of how we need to eat. And I'm not talking about like if you're craving sweets because you're overgrown with yeast or your specific bacteria that feeds on sugar, right? The bacteria that feed on kale is certainly not the bacteria that feed on sugar. So context does matter, but often is we eat food and then we're bloated or we're distended or we have obviously gas, constipation, diarrhea. We're not eating the right foods, but yet we continue to repeat that same cycle. So when I have patients that come in, they're pooping maybe every 2-3 days and they feel that's normal, but yet they have aches and pains, and they don't correlate the pain with the fact that their inflammatory burden is so high. Their immune system has been revving up for so long now that now they have toxins deposited into joints. Yeah. So what happens is you're eating food and you're ignoring the signal that something is wrong, or certainly you're eating fast food devoid of specific nutrients, right? And so we are now, we're overfed but malnourished.
Yes.
Okay? So beyond any sort of test, I like the patient to just step back and say, how does this food make you feel? Yeah. Does it give you more energy or otherwise? So when I have a conversation with patients, I make it simple. Nutrition is going to heal you or it's going to hurt you. There's no in between. Same thing with medicine, same thing with supplements, same thing with alcohol, same thing. Everything is exercise as well. Yeah. It's going to heal you or it's going to hurt you. So the context certainly matters. So I invite patients to just look inward and then just assess, okay, how does this make them feel? Right? With our stubborn, chronically ill patients, when we put them on a carnivore for just a very brief time, they begin to feel great. The bloating goes away, the distension goes away. Now, I like fiber in the context to get people eliminating with a degree of regularity. So transit time should be somewhere between the 12-16 hours. We can measure that. I mean, I had a patient come in who she was going once every 3 weeks, a young lady.
Wow.
And I've been seeing this more and more common now. We get some young athletes that come in here and literally they're going once or twice a week at best.
Yeah.
I mean, people don't realize, and that's abnormal, but we begin to normalize what's abnormal.
Yeah.
That's the problem.
And to be fair, I remember distinctly when I was a medical student over 30 years ago, listening to this lecture by a gastroenterologist who said, well, you know, some people poop every day and some people poop once every 3 days, and that's normal for them and that's okay. And, you know, I think we've been learning more as time goes on, and now we recognize that no, pooping every 3 days is not normal. You should be going every day, sometimes twice a day. Yeah.
I like full evacuation AM and PM. That to me is the gold standard. Now, some of my peers suggest you should go after every time you eat with like
Hmm.
3 full meals. So then you have
Hmm.
3 full bowel movements, which I
Yeah.
also like as well. But certainly this metric of, everyone's different, maybe once every few days for someone is normal. I
Yeah.
don't necessarily adhere to that doctrine. So
No.
I think that's a disservice. Now, as far as the testing goes, we definitely do like tracking data. I don't like guessing. I certainly like testing. The microbiome test that we use for me is very, very profound. Often enough, my patients prefer the food sensitivity, which often comes up with a lot of red flags with what the patient is currently eating because of the degree of intestinal permeability. So
Yeah.
that's when we suggest an elimination diet, or at the minimum, obviously avoiding the foods that are triggers because it's just gas on the fire. So
Yeah.
the test that we use, whether it's the GI map with diagnostic solutions or Vibrant, we use a lot more with their gut zoomer and looking more in depth to the specific strains of your microbiome. I think there's a couple new tests that I'm really bullish on that's coming out in the pipeline with Therobiome and I think Gut ID. But needless to say is we are very, very bullish with the gut test only because to me, I define that as longevity medicine. Until you can clean up someone's GI, until you can optimize specific ratios within the gut, you're never going to optimize health and human performance because we realize we are more bacterial DNA than we are human DNA by a
Hmm.
factor of a minimum 10x, right?
Yeah.
So we're walking microbes. Okay.
Yeah. Yeah.
I'm trying to talk to my bacteria every day. I'm rubbing my belly. I'm trying to make best friends with them. I want it to be the best environment ecosystem so they can begin to thrive because they feed me. So people think you are what you eat. No, you actually, I know we said what you eat, assimilate and eliminate, but it's also you are what you feed your bacteria because they run the show.
Yeah.
They will stabilize your mood. They will attenuate your inflammatory load via your immune response. So you said I like to connect the brain gut axis via the vagus nerve. We know how that innervates every single step of digestion. My big BIG is brain, immune, gut. When you connect those three, you're getting someone better, whether it starts in the brain or the gut or vice versa. We know that the gut talks to the brain 10 times more volume
Hmm.
versus brain to gut. So when someone has a gut instinct, that matters. We've just lost the art of looking inward to recognize that. Or we just override that, say, oh no, I'm going to keep doing what I'm doing because someone else told me that, right? That is the worst disservice. When you're looking at the microbiome, specifically with nutrition, like we think, oh, we got to eat this way. These are the superfoods. No, I couldn't. That's so far from the truth because some of my chronically ill patients, you give them, and we were talking about glutathione with one of your patients, and the wealth of knowledge you have is incredible. So I appreciate kind of some insights that you shared in our previous conversation. When you give someone like sulfur compounds, an example with SIBO, you're just in fiber, you're going to light them on fire. These are superfoods, but yet not super for someone at that time.
Yeah. Yeah.
So that's the whole personalized approach to medicine. And that's really predicated upon testing too, because you can see very quickly where to make the biggest impact to improve someone's health outcome.
Absolutely. How do you explain to patients how their gut is affecting their mental clarity, mood, and even memory?
Yeah, so going back to, 90% of the serotonin that is produced in the gut, if you look at it, we produce 400 times, up to 400 times more melatonin in the gut than in the pineal, which we didn't only
Hmm.
realize until recently. So when you're looking at mood instability, it starts with the gut. Someone who has depression, who has anxiety, who has mood swings,
Yeah.
that's an unhealthy microbiome. That's dysbiosis. I
Yeah.
had probably my last 5 patients within this week, all on different SSRIs, anti-anxiolytics, antidepressant medications. I clean up their gut, not
Hmm.
only from their nutrition, but certainly some overgrowth of pathogenic bacteria, virulence factors. Certainly parasite can play the mycobiome or the impact of SIFO and fungal overgrowth. Obviously, the interplay within each of these species will impact how your hormones are secreted, and neurotransmitters are hormones of the brain. So until you clean up someone's gut, I don't know how they ever come out on top. You're not deficient in a medication.
Yeah.
You're deficient in a healthy microbiome. And until you can reframe that paradigm, it becomes very difficult. And the problem is that I see so many of these mental health patients that they've done a colonoscopy, they do an endoscopy, everything looks good. They go to their gastro, everything seems to look fine, but yet
Mm-hmm.
they're only feeling worse and worse.
Yeah.
And the breakthrough becomes is when you clean their nutrition, when you clean up their gut, often it's a lot of bad bacteria that begin to overgrow over time. When you restore healthy balance, they can breathe, they can relax, and now they can repair.
Yeah. Yeah, absolutely. Do you see emotional trauma or stress contributing to gut dysfunction? And how do you address that in a clinical setting?
Piggybacking on our previous conversation prior to this with the emotional trauma, and we were just talking about fascial work and the power of fascia.
Yeah.
So we recognize now that fascia doesn't just encases muscle, it acts on muscle, and muscles move bones better than anywhere else, better than any sort of adjustment or anything like that. And we need healthy bones naturally. We also need healthy muscles and we need healthy hydrated fascia, but fascia also stores our emotion. So when you're talking about patients with trauma, we get people doing fascial stretch therapy that have a tremendous release and start crying on the table. And it's just from healthy movement. We are just manipulating fascia to provide a release, whether we're doing cranial sacral work or throughout the entire body. So emotions are very powerful. Obviously, there's trauma involved here. And whenever you're talking about trauma, stress impacts negatively on our microbiome. It impairs healthy stomach acid secretion, which provides an interrupted signal for digestive enzyme secretion and bile secretion from the gallbladder and the pancreas, respectively. If you have indigestion, if you call it, then you have food getting into the small intestine that's not entirely broken down. What do you have? SIBO, small intestinal bacterial overgrowth. Or you'll have translocation from the colon into the small intestine because the gatekeepers are open. So whether that's the lowest esophageal sphincter or looking at the ileocecal valve, when you have digestive perturbations throughout the chain, you are not going to feel right. You're going to feel off. How do we honor the principle of feeling off? Well, we begin to have anxiety, but it's not a product of sometimes just our stressful thoughts about career or finance or our loved ones or family. It sometimes starts internally, and that's where it's often neglected or overlooked. So my goal is to figure out what's going on under the hood. Let's clean everything else up because 100% of my patients get better when you start cleaning up the microbiome. Now, beyond that, when you talk about stress just cripples the entire system.
Yeah.
And our modern lifestyle is not conducive to our evolutionary biology. Okay. We're doing everything backwards. We're under heavy blue light exposure, even into the late hours of night. That's stress. We're eating late at night. That's stress. That's insulin resistance. That's further inflammation. We are always pressing the gas until we are empty. And then we hope that there's a gas station nearby. Okay.
Yeah.
So with stress in the vagus nerve, you have an interrupted signal again, which starts in the hypothalamus, and it doesn't allow the body to secrete adequate levels of stomach acid because you have an interrupted signal. Same thing with your pancreas or your gallbladder to release bile to bind to toxins to help with motility and release for elimination. So when you have perturbations all along the system, there's no way you can be in a healthy state there, or it's only time until, again, chronic disease begins to set in, assuming that the stress load can somehow be attenuated. Now, looking at stress directly, this is probably where I start all my patients. So in terms of healing, you were asking about core principles earlier. So I have kind of several years to heal, but I'll give you the order of operations. The first one is circulation and perfusion. So you have to make sure that you're able to deliver nutrients to the tissue. We talked about the technology that you integrated, assessing the endothelial lining, the blood vessel, the capillaries, the glycocalyx. This is absolutely brilliant. This is layer one for us with all our patients. Layer two is blood sugar management. Because if your blood sugar is high, it's not only just from what you're eating, but it's from internal stress or dysbiosis.
100%.
The internal stress drives the dysbiosis. That's what happens. People only raise their hand with like, Daniel, I can't fit in a dress. Or like, man, I got a fat tire on my belly. I want to lose some weight.
Yeah.
Okay. I always say I don't care about the profile because I know I'm going to get you better. I'm going to help you fit in that dress when I internalize the blood chemistry, when I manage the blood sugar, when I know how you're reacting to certain foods. So we'll get someone on a CGM to evaluate her, or we'll take a look at that very, very closely to help reduce A1C as fast as possible with some different tactics. Berberine one is an example. I know we can get into that strategies later, but Certainly there's ways to optimize blood sugar management so you're not constantly inflaming yourself. And if you're inflamed, you're fat storing, you're not fat burning. So they care about the dress. I care about the internal chemistry
Yeah.
because
Yeah.
they're going to thin their dress faster. The third layer and fourth go hand in hand to me is gut and immune. We know about 90% of our immunity resides in our gut lining. So when I fix the gut, I reduce the inflammatory load. Your immune system autoregulates. Now layer 5 is hormones. Now you're secreting your happy, healthy hormones. Now you're looking how you want to look. But that's tier 5. So going back to stress, we have a very, very profound, very inexpensive way to help people. It's called my stress sleep reset, which again, from I have to credit my mentor, Dr. Kaus, who's also in Houston. And it's melatonin in conjunction with L-theanine in therapeutic dosing. Then we'll also add in Ganoderma, which is the reishi mushroom spore, which helps with rebuilding immune function, reducing the inflammatory load, optimizing blood sugar, and its adaptogenic benefit, obviously, on attenuating the stress response as well. So that kind of 1, 2, 3 punch, it's almost everyone walks away only because of how high their stress profile is. Like if we do a 4-point salivary cortisol, I mean, unfortunately, it's difficult to find people that are not stressed, right? It's a product of our modern lifestyle. Maybe we should take a page out of my predecessors or my heritage of Sardinians, the blue zones, or, Okinawa, where you work less and you live more, right? And community and building your tribe, I think is critical to that. So that's why I love being able to have this conversation with you.
Yeah. Awesome. Can you share a story where healing the gut led to a cascade of unexpected improvements?
One that comes to mind was when you asked about trauma and the mental health patient. We see a lot of patients here with intrusive thoughts who are trying to overcome something very, very difficult. And it's a privilege for us to be able to work with specific patients and really help them, because the harder the case, the more profound the transformation, right? And so one that we have in mind, and we have several testimonials on our page where you can find us, was on several different medications, again, all dealing with trying to help him overcome depression, anxiety, instability in his mood and mood swings. All I did was clean up the gut. That's it. I started with a stress sleep reset. Okay. Then I got him into a 5R GI protocol, kind of tailored specific for him.
Yeah.
Cleaned up his nutrition. And he goes, Daniel, I didn't realize how much of what I was eating was actually triggering inflammation and triggering my depression, anxiety. And he thought he was eating healthy. Too often people ask, what are good substitutes, like to try to get in stevia or monk fruit, or these are great substitutes, but we have bitter taste receptors all over the body, and bitter is better. So my goal is, let's find food that you were intended to eat rather than kind of substitute sometimes that we're trying to still feed our cravings, right? And that to me is indicative of, again, some level of dysbiosis or unhealthy commensals. So the goal here is, once you begin to clean up someone's GI, not in terms of only kind of their microbial species by putting on specific strains of probiotic or getting them to fermented food when tolerated, but also combining that with nutrition and maybe like a food sensitivity to figure out why they're being lit on fire. It's interesting because another case comes to mind is, I had so many patients that they think they're doing everything right. One patient in particular, postmenopausal patient, she's like, Daniel, I'm eating healthy. I'm doing carnivore with eggs and yogurt, and I'm doing my meals. I'm meal prepping for the entire week. I was like, okay, this is wonderful. I want to do genetic tests on you because I'm curious what your predisposition to histamine is, because no matter what she was doing, she was constantly on fire, meaning like constantly felt inflamed. She had neuropathy and she had tingling in her feet, tingling in her toes, couldn't walk up the stairs without pain. Okay. And so I said, let's do a genetic test. I just want to see specific predispositions. Histamine was very high risk for her. What is she doing? She's meal prepping.
Yeah.
That's high histamine foods.
Yes.
She's burning herself on fire.
Yeah. Leftover foods are high in histamine. Yeah.
Next is we did a food sensitivity test, and she was, I think, off the chart on dairy and egg. Very, very high. Like it was above 30. Yeah. And she was doing that every day because she thought like kefir, fermented yogurt, that's great for the microbiome. Yes, but perhaps not, especially with high histamine patients, or in terms of what you're going through, right? And same thing with the other culprit with eggs that she was eating every single day, and beef. She had high reactivity to beef. So everything that she was doing was lighting her on
Yeah.
fire.
Yeah. It was just
Does that
adding
make
to
sense?
the
So it's
inflammation. Yeah.
until you test, you don't know, right? Because beef is typically
Right.
benign, right? You hear the carnivore diet, people reducing bloating, feeling so
Yeah.
much better, more energy, clearer skin.
Yeah.
But for
Yeah.
someone, I had a gout patient, same thing. So he's of Asian descent and would do a lot of Korean barbecue. Now I went over like what I wanted. I don't want to eat. We did a food sensitivity, and his beef and pork off the chart.
Yeah.
Like, so
Yeah.
every time he was eating a meal, again, it's just lighting gas on fire. So
Yeah.
the interesting when you ask these, there's so many case studies, but the biggest thing is just we don't know what we don't know. And that's the power of a test. I don't
Yeah.
want my patients to spend more money if they don't have to. We try to keep costs as lean and mindful as possible. But the reality is, the power now becomes in some of these tests you can leverage so that you can help someone understand, okay, this is what your trigger is. We can cut some things out, like a food elimination diet obviously is the gold standard. But again, when you're introducing, sometimes you don't always feel these symptoms because an IgG response can happen up to 21 days
Right.
after exposure from a protein.
Right.
So this is
That
where
delayed
this becomes,
reaction.
yeah, it becomes so interesting. I hope I answered that question though.
Yeah, absolutely. Absolutely. Well, I want to turn the conversation a little bit towards peptide therapy. And, peptides are pieces of protein that do cell signaling within the body. So when did you first start incorporating peptides into your practice, and what drew you to them?
I think this was almost actually maybe even over 10 years ago now when it said not for human consumption on the label. And I was using myself as the guinea pig. And so I always test myself first with everything. So I
Yeah.
went down there and bandwagon. So I have heritage. My ancestors are from Italy, from Russia. There is extensive data and research coming out of Russia with Russian scientists and the efficacy of peptides. Obviously, they were using it early on with their athletes, Olympic athletes in particular. Same thing out of China. That's why they were kind of always one step ahead once upon a time. So we know they work. We also know they're extremely safe. I don't use anything that I don't consider safe that I wouldn't use on myself or my children. So the power of peptides is profound. Prior to this conversation, I had a patient who came in for rehab. He came in bilateral pec tears, both sides from a construction accident, snapped both simultaneously. And he just was referred to me by happenstance. Like I was walking into another clinic, which we partner with here, and she goes, "Hey, you should talk to the doc about," because he had a peptide question. And I go, "Yeah, we're glad to be answered." He's like, "Yeah, I was wondering, is there something you think could benefit me?" So sure enough, his surgeon just calls me the other week because his healing, they didn't want him to start rehab for 6 weeks after the surgery.
Mm-hmm.
He's already healed.
Wow.
Completely. No pain, doing like anything, no limitation. He just confessed to me. He's like, "Daniel, I just bicep curled 60 pounds, 60. I mean,
Wow.
we're going to be training him. He's going to be trying out for the UFL as a kicker. But the point is that the power of peptides and healing is, I don't like the word steroids, but it's like healing on steroids.
Yeah.
Okay?
Yeah.
The capacity to provide the body the right signaling. So two that we use in there as an example, BPC 157, which I think when I was at the World Peptide Conference with Dr. Aziz, I think people believe it should be in our drinking water. So it's naturally produced in our gastric tract as in our enzymes here. So what happens is when you provide someone the right signaling molecule, it ushers in more nutrients, more signaling capacity to deliver nutrients to the site of damage to heal. We pair that in conjunction with TB500 or a fragment of your thymic peptides with involutes as we age, which really boosts the immune system, but also helps rebuild the cellular matrix. So that 1-2 punch allows for the ushering in of nutrients, all the beneficial cytokines to help restore the damaged tissue, plus in conjunction with the extracellular matrix, rebuild what was distressed much, much faster than our own capacity. That's why I equate it to healing and steroids. But we know the efficacy of peptides, something as insulin for so long.
Right.
We just don't necessarily construe it as such. Same thing like a GLP-1 as an example too.
Mm-hmm.
So various peptides, various lengths of sequence of amino acids. The problem becomes when the FDA just comes in where I used to compound these at the same pharmacy that it had the green light. There was no
Yep.
issues once upon a time, but now
Right.
we're a little bit restricted, and our very sick autoimmune patients, were very reliant on some of these thymic peptides who had tremendous reversals, feeling great. When you can't access certain things, yes, there's other ways to help patients heal, but I like using shortcuts, if you will.
Yeah. Yeah. No, absolutely. Which peptides have you seen the most success for with healing intestinal lining or reducing inflammation in the gut?
There's a brilliant formulator, Kyle, with Level Up, who's put it together in all in one. So the two immediately are BPC 157, which is, again, is naturally secreted in our gastric enzymes. And then second is that larazotide, which helps heal the tight junctions. And there's a lot of clinical data to demonstrate that. So those to me are the best two. Now you can integrate KPV if there's a level of dysbiosis as well, which the problem with the perturbation in the tight junctions is that you have damage to the gut lining, tight junctions open, xylem comes to the site, releases whatever kind of undigested protein or pathogen into the bloodstream, and now you have chronic inflammation, systemic inflammation, a heightened immune response. So larazotide helps repair that, the tight junctions very, very well. But to me, peptides aren't always enough. Sometimes, obviously, we want to get in healthy fiber if we can, if the patient can tolerate it. Why? Because the postbiotic or saccharolytic fermentation of these microbes or proteolytic fermentation of these microbes drive short chain fatty acid production, such as butyrate, acetate, propionate, which we know has helped rebuild a mucosal layer which sits right above the tight junction, which then creates a healthy gate to prevent that from happening again when pathogens come to site or undigested food, any other toxins that we're constantly under deluge from. So the two that come to mind, again, peptides are BPC 157 larazotide in conjunction with KPV where prudent. Other ingredients I like, which is great in this formulation too, glutamine feeds the colonocytes, the enterocytes to rebuild the mucosal layer, as well as zinc carnosine. So critical when looking at secretory IgA. So vitamin A, obviously you need vitamin D for everything. It's a hormone. Vitamin E, which is great for balancing hormones as well. And then glutamine, colostrum if someone can tolerate dairy. Otherwise, we use a lot of immunoglobulins, which helps as well.
Yeah.
So that was kind of a more comprehensive answer, but definitely peptides for the win. And the beauty of it is they're oral now.
Yes.
And some people are doing interesting things. I think, I'm forgetting her name, Sarah, the Gene Queen. I forget the name of her company. She has a buccal delivery, which is oral, so you can put it at the roof of your tongue or in the mucous membrane of your mouth.
Yeah.
So that enhances absorption. But otherwise, oral or definitely injectable if we're doing something more, someone kind of comes in with specific injuries and trauma. But yeah, going back to the gut, a great right, oral is covers
the
your
oral
base.
is ideal for the gut healing, I think. It just kind of stays there in the gut.
Yep.
Have you seen any peptides that make a difference for patients with cognitive decline or persistent energy issues?
Yeah, cerebrolysin is a good one for the brain. They have, again, Level Up, just shout out, I guess, to them because we use a lot of their products. I have no affiliation. I just like using stuff that works. So they have a good neural formulation as well. You can use something like some nasal sprays sometimes too. MOTS-C, CLANT comes to mind. It also improves the mitochondria. Anytime you have an eye oxidative burden, let's go back one step even further. Leaky gut, leaky brain.
Yeah.
So first we got to fix the gut, and in turn your brain's going to come back online. So when we go back to kind of our patients with depression or anxiety, also reframing that too. I know you asked that question previously, which I didn't answer, in terms of anxiety. To me is when you're ruminating too much kind of in the future, right? You're not really fulfilled in the present. And I'm not trying to make this a spiritual conversation necessarily, but living in the present is key, because too often we're thinking about the next step, we're planning ahead, we're trying to design our future, and then we lose track of the present. And depression is obviously ruminating in the past. And so trying to let go, I think, is also very powerful. But going back to the power of the mind, the power of the mind is tremendous. It can help you heal. I mean, we have so many anecdotes with people overcoming cancer just with kind of thought. So I always say, physiology follows psychology. Certainly, we were discussing vagal nerve tone and different ways to come in and, stimulate the vagus nerve to just reset, meaning get yourself out of fight or flight, resynchronize your circadian rhythm, allow the body to restore itself in a more parasympathetic state, which forces us to downregulate stress. And it goes both ways. One feeds forward to the other, but getting out in nature, just even time with friends, walking along the beach, 6 diaphragmatic breaths, as they say in Japan, really can shift someone into a parasympathetic state, which has a profound effect on the brain. If you're looking at breath work alone, again, a lot of things we say start in the gut, but we recognize that connection. And so too often is if one is overlooked, you're never going to optimize the other. But so those are some of the peptides that I like for brain. Some people are using nicotine. Some of our sick patients actually, like with mold or Epstein-Barr or COVID, long haul COVID, we'll use very kind of low doses to kick it off the spike protein. But otherwise, I mean, nicotine can be nootropic. I don't condone necessarily cigarettes or smoking, but we were speaking like on your podcast about microdosing. So there are certain nootropics that will help as well with enhancing cognitive function. If you look at like any sort of the paracetam or aniracetam, those will also help. Sometimes there can be some negative consequence because you can get sometimes jittery or difficult for sleep. So being mindful of timing. People are looking for that edge, but I usually found they haven't mastered the foundation, right? It's the foundation 5 as we discussed earlier, but those are some of the peptides that we use for enhancing cognition.
Yeah, I feel like peptides are a nice sort of icing on the cake. They're not going to be fixing things unless you've done the foundational steps first.
Couldn't agree more.
Yeah. So what would you consider essential when it comes to patient education or protocol design with peptides?
I think you just said it, for them to be optimized. So let's look at even one layer further with, exosomes and stem cells as an example, right? The body has to be able to receive it. These molecules are absolutely brilliant in their capacity to help us heal, often enough, most of which reside within us. So in order to set someone up for success, we have to have a body in a state where it can take in some of these exogenous molecules. And so it's the same thing like with hormone replacement is if your toxic load is very high, it's difficult for the hormone to dock and receive that signal. Peptides can be no different in some capacity, depending on what pathway that we're working on. So sometimes it is very pathway specific, but the principle is to try to restore someone's micronutrient balance and to reduce their toxic burden. Because when you do that, your body is in a more receptive state to allow these molecules to do what they were intended to do, instead of being just degraded to nothing almost because the toxic burden, the oxidative burden is just far too high. So what are we doing? Again, mastering the foundation, the stress sleep reset, supporting someone wherever they need support, whether, again, if they're overcoming trauma, personalized nutrition plan obviously will help. What else are we considering is we're definitely cleaning up the gut microbiome. So when we start there, we find tremendous results ensue. So the athlete that I spoke about, bilateral pec tears where we did the injectables with him, where tremendous level of success. I mean, I was even surprised how quickly he healed. Like sometimes I surprise myself. We had a kid, and this is actually happening more often, a pelvic avulsion fracture from just kicking a soccer ball. Okay. Wow. I'm doing hormone testing, specifically testosterone for ET, looking at our younger athletes. What are we finding? They are half of what they were when I was their age. So what's happening, I see, is that because our toxic burden is so high, stress fracture on the rise, injuries are on the rise. We would do injections with peptides with these athletes, and it was incredible. Again, sometimes I get surprised how quickly the body can heal under the right circumstance. With kids, usually that happens quicker because their toxic burden isn't necessarily as congested, if you will, as some of our aging population, and myself included as adults. But needless to say is with these peptides, my goal is first to kind of clean up where I can. So we'll also use a medical detox, an example. So the stress sleep reset, we're cleaning up the gut, supporting the liver. Then we're going to layer in some of these really powerful peptides. And now you have people feeling not great, but extraordinary. I mean, it just takes them to the next level. But again, that doesn't happen until, again, you're working through that healing journey, right? So people often like, oh, let me just we discussed that, I think, with a GLP-1 on your podcast. People just think that there's a shortcut. I can take this and a miracle happens. Same thing with peptides. It doesn't work that way, unfortunately, right? So we have to discuss with our patients lifestyle factors to make sure that when we use new tools in our toolkit, that it's received with the highest degree of potential.
That's awesome. Yeah, absolutely. Well, Dr. Chille, it has been an absolute delight having you on the Functional Edge. If people want to find out more about your practice and how to get in touch with you, where do they go?
So I'm also at the TBD Fit podcast or tbdfit.com. So that's Total Body Diagnostics. So TBD FIT. tbdfit.com. That's where you can find myself, my staff. We do telehealth consults if anyone wants to ever learn more. You're just incredible with your practice too. Learning kind of about everything that you're doing even offline is extremely profound. So I know that your patients are in tremendously good hands. And the point is, I mean, we're always learning, growing together, right? Science is evolving, use of peptides is evolving, is how we're integrating exosomes and stem cells to help potentiate the power for healing. I know we spoke about hyperbaric, you do it at your clinic, we do it in ours for stem cell proliferation. I mean, the body was designed to heal. Sometimes we just have to get the heck out of the way.
Yeah, absolutely. Well, thank you for joining me on the Functional Edge. I hope today's episode gave you fresh insights and practical tools to level up your life. If you found value in what you heard, don't forget to hit subscribe, share the podcast with someone who needs it, and leave a review. It's the best way to support our mission of bringing powerful health solutions to more people. For more resources, updates, and behind-the-scenes content, visit drjuliaward.com. And until next time, stay strong, stay healthy, and keep living on the Functional Edge. Thank you for joining me on the Functional Edge. I hope today's episode gave you fresh insights and practical tools to level up your life. If you found value in what you heard, don't forget to hit subscribe, share the podcast with someone who needs it, and leave a review. It's the best way to support our mission of bringing powerful health solutions to more people. For more resources, updates, and behind-the-scenes content, visit drjuliaward.com. Until next time, stay strong, stay healthy, and keep living on the Functional Edge.